my name is Shifa Julius and my student ID is 22087502. Today I will be presenting my Assessment 2 case study. Imagine that you're suddenly unable to speak clearly or move only one side of your body. These are symptoms of someone experiencing a stroke, a medical emergency that affects people worldwide. Today we'll be focusing on the case study of Miss Teresita Manalo, a woman who is experiencing an embolic stroke. This type of stroke occurs when a blood clots in the body of which then travels to the brain, blocking the flow of oxygen-rich blood. It is usually sudden and severe. Recognizing the early signs allows for prompt diagnosis and immediate intervention. Miss Manalo was admitted to hospital 2 days ago with dizziness, palpitations, generally feeling unwell, and found during night shift round with decreased level of consciousness, slurred speech, and left-sided weakness. I'll be talking about her vital A to E assessment and highlighting the rationales for 4 high-priority nursing interventions to manage her conditions. I'll also discuss the medications that will play a role in her recovery. To begin with question 1, I will discuss the A to E assessment for Miss Manalo. Starting with airway, it is documented as patent, which means there is no sign of obstruction in the upper airway, including the mouth or nasal passages. In patients who have experienced a stroke, maintaining airway patency is critical, as neurological impairment can compromise airway and protective reflexes such as the gag or cough reflex. Although there is no immediate airway concern, she presents with a reduced level of consciousness and slurred speech, both of which can increase the risk of aspiration. Therefore, close monitoring of her airway is essential, and interventions to ensure airway remains clear should be initiated. Moving on to breathing, Teresita's respiratory rate is elevated at 26 breaths per minute with shallow effort indicating tachypnea. Her SpO2 is 95% on 6 liters via Hudson mask, suggesting a compromised respiratory state requiring supplemental oxygen. This pattern reflects increased work of breathing, likely due to impaired neurological control following her stroke. Shallow rapid breathing may also indicate increased airway resistance requiring close monitoring. While oxygen therapy is appropriate, it's important to frequently reassess oxygen needs to avoid both hypoxia and oxygen toxicity. In stroke patients, respiratory changes like this can also signal neurological deterioration, particularly if the brainstem is involved. These signs guide decision on escalation of care and ongoing respiratory support. In circulation, she is tachycardic at 132 beats per minute and hypertensive at 170/97. Teresita is described as peripherally cool with a capillary refill time of under 3 seconds, and pitting edema is observed in both her feet. The presence of bilateral lower limb edema may suggest fluid overload or may be an early sign of cardiovascular compromise, such as heart failure, which can occur after a stroke. It highlights the need for ongoing fluid balance monitoring to prevent complications such as pulmonary congestion. These circulatory findings reflect the compensatory response to neurological stress. An ECG should be performed to assess arrhythmias, particularly arterial fibrillation, a common cause of embolic stroke. Cardiovascular assessment should be continually monitored for any deterioration or changes in clinical status. For disability, Ms. Manalo has a GCS of 12 out of 15, indicating reduction in consciousness. She presents with left-sided facial droop, left-sided weakness, and slurred speech along with aphasia. This suggests impaired language function. She can follow commands with the right side squeeze with the right hand and move her right leg. Her pupils are round, equal, and react briskly to light. These neurological signs are consistent with a right-sided embolic stroke, likely affecting areas of the brain responsible for motor control and language processing. What is aphasia? It is a language disorder commonly caused by brain injury, including a stroke, resulting in difficulty speaking, but the ability to understand language remains intact. While aphasia is typically associated with left hemisphere strokes, research shows it can also occur in right-sided strokes, particularly in left-handed individuals or when non-dominant hemisphere of the brain is involved in language. Approximately 97% of the population has language dominance in the left hemisphere. Therefore, the presence of aphasia in this case suggests left hemisphere brain involvement, or potentially cross-aphasia is Miss Milano if Miss Milano is left-handed. The immediate activation of the stroke protocol is essential as stroke outcomes are highly dependent on early recognition and rapid intervention. The stroke assessment tool FAST further supports these findings. F for face, the left-sided droop, A for arms, left-sided weakness, speech, S for speech, aphasia, T for time, the onset of the symptom was approximately at 1 a.m. Under exposure, it is documented that Miss Milano is afebrile with no signs of external bleeding or infection. This is clinically significant as a fever after the onset of a stroke has been associated with poorer outcomes and may indicate underlying infection. Therefore, regular temperature monitoring is essential, and any elevation should prompt further investigation to rule out infection. Moving on to question 2. Question 2, I will outline 4 high-priority nursing interventions for Miss Milano's embolic stroke management. The first intervention is maintaining airway patency. Therefore, positioning Miss Teresita in a semi-Fowler's position to optimize cerebral perfusion and reduce aspiration literature supports the upright position also facilitates oxygenation by improving lung expansion. If oxygen falls below 94%, supplemental oxygen should be administered to prevent hypoxia. The second intervention is frequently monitoring neurological observations. Evidence shows that changes in GCS, pupil response, and motor function can help detect early signs of deterioration. Timely identification of these changes has been shown to improve outcomes by prompting early medical intervention. The third intervention is blood pressure and heart rate monitoring. Hypertension is common in stroke patients and increases the risk of cerebral hemorrhage and further ischemic damage if not appropriately managed. Continuous monitoring of BP and heart rate enables early detection of instability and guides safe administration of medications needed. Ensuring BP remains within the range supports cerebral perfusion without increasing the risk of bleeding. Final intervention is fluid management to prevent fluid overload or dehydration, both of which can complicate recovery. Monitoring fluid intake and output using a fluid balance chart can help guide appropriate fluid therapy. Clinical signs such as peripheral edema and changes in urine output should be documented and reported. For the third question, I have selected 3 medications to discuss in relation to Miss Milano's care. For each medication, I will outline the key nursing considerations, focusing on assessment requirements, safe administration, and potential side effects. The 3 medications I will be discussing are metoprolol, IV alteplase, and heparin IV infusion. Firstly, metoprolol 50 mg BD is prescribed to manage Teresita's elevated BP and heart rate. Before administration, a thorough assessment of vital signs is essential, particularly heart rate and BP, as metoprolol is a beta blocker which lowers BP and heart rate as it can cause adverse effects including bradycardia and hypertension. Oscillation for lung sounds is also necessary as beta blockers may induce bronchospasms, especially in patients with undiagnosed respiratory disease. Therefore, we should monitor for any signs of respiratory distress such as wheezing or shortness of breath. Given Teresita's stroke, her ability to swallow should be assessed due to the risk of aspiration. If her swallowing is compromised, we should consider holding the dose and consult the medical team for alternative routes. Common side effects include fatigue, dizziness, and worsening peripheral edema, which may mimic or exacerbate signs of heart failure. Nurses must monitor new or worsening symptoms and educate the patient not to abruptly discontinue the medication due to the risk of a rebound tachycardic or hypertension. The next medication is IV alteplase. It is used to dissolve the clot-causing Teresita stroke and restore blood flow to the brain. It works by breaking down fibrin in blood clots. Early administration within the 4.5 hours of symptom onset improves recovery.
Before giving alteplase, nurses must assess blood pressure and neurological status, as high BP increases the risk of bleeding. The medication is given via IV bolus followed by a 60-minute infusion requiring close monitoring for bleeding or deterioration. Common side effects include gum or injection site bleeding, nausea, and allergic reactions. The most serious risk is intracranial hemorrhage, which requires urgent action. Due to possible communication issues post-stroke, consent may need to involve next of kin, and clear updates should be provided throughout care. Next medication is IV heparin. It is prescribed to prevent further clot formation and reduce the risk of another embolic stroke. It works by inhibiting thrombin and factor XA to stop the clot growth. Before starting heparin, check baseline labs including APTT, platelets, and renal function to guide safe dosing and reduce bleeding risk. Regular monitoring of vital signs and signs of bleeding is essential. Heparin is given via a IV bolus followed by a continuous infusion using a pump. Doses are adjusted based on APTT and require double nurse checking for safety. Major side effects include hemorrhage. Infusion must be stopped and escalated if suspected. Other side effects include hyperkalemia, injection at site irritation, and osteoporosis within long-term use. Thanks for watching the presentation. Bye!